I think you could just really encourage them to try to be open and honest with, communication, because we do have to, sort of delve into their lifestyle choices, for example. Like, we have to know those kinds of things because it can impact on treatment, and just so that we know that we're giving them the right information. So just to be open and honest with what they're telling their healthcare workers, their clinical nurse consultants. So maybe if we say, do you take drugs? And they're like, no. Or do you drink alcohol, for example, is probably the thing and they're like, no. Or maybe 1 or 2 drinks a week, and then they might come in on Monday and you look at their liver function tests and their liver function's right off, and then they've got to have chemo, and when you start to ask more questions, it's like, well, yeah, I don't really drink that often, but I binge drink. Like, I'll go to a party and I'll drink, 3/4 of a bottle of vodka. So, and no judgment at all. We just like to know the information up front so that we can support them in the best way possible. So just be open and honest. I think for the young people to be open to accepting the help that we offer. Sometimes we find people are quite young people are, I know I'm okay, I don't need that support, I'm okay, but it's often then when the wheels fall off, and it's much harder to manage in a crisis situation, it's much harder to sort of support that young person if you haven't got those things in place to begin with. For example, like looking at, like we often give pages of websites, so I think the internet on recommended sites can be really useful, so just informing themselves of what, like looking at like CanTeen websites, for example, and Red Kite websites and all those kinds of things that are the support that's available to them. There's so much information out there. I think it's important that they kind of get informed about, what it's going to be like, and sometimes I think keeping friends in the loop, that can go both ways, but I think it's important to have, some of your friends to keep them in the loop, because again, we sometimes have young people who don't want to involve friends, or they sort of cut themselves off, but I think that's important to try and stay connected with some friends and stay connected with family, and as much as possible. It's not always, and again, as I said before, everyone's different, but just to prepare themselves to, and I guess just to be open and honest with what they want. Like, sometimes it's okay if the 16-year-old doesn't want to be told anything and mum wants to be told, but wants the mum to, everything to go through the mum is just to, make sure that, so that we can meet their needs, that they're letting us know what they are. Having that initial discussion up front about how they want to manage that. Do they want us, for example, like a clinical nurse consultant, to come to their consultation so that we can sit in, so that we're listening, so that they've got, that second or third pair of ears to listen to what the consultant's saying, to decipher the information, and to sometimes talk about it after to make sure that they have heard the information, because they often don't. Like, some of these consultations with doctors can go for an hour, and I can see, you can see 45 minutes into it that the person's kind of going, oh, that's enough. But it's part of what a doctor has to do to make sure that these things are talked through.